NCLEX note on renal system. This is part 2 and today let's start with nephrotic syndrome. In this kidney disorder, there are main 4 things to remember: massive proteinuria, hypoalbuminemia, edema and hyperlipidemia. So there are these main 4 symptoms, that's why it is known as nephrotic syndrome. The common causes are minimal change disease, focal segmental glomerulosclerosis, diabetic nephropathy, lupus nephritis, and amyloidosis. And the clinical manifestations are proteinuria, edema, hypoalbuminemia, hyperlipidemia, fatigue, weakness, weight gain. If this condition is not treated on time, it can lead some complications like infection, thromboembolism, acute kidney injury, and hypovolemia. And the nursing consideration are monitor urine output, assess for edema, monitor electrolytes, infection control, monitor for complications. And the medical management depends upon the sign and symptoms plus complications. In this condition, steroids, for example, prednisone, diuretics, statins, ACE inhibitors, and albumin replacement is done. And here we go for dietary management. Avoid high sodium foods, high fat foods, excessive proteins, and encourage for low sodium diet, moderate protein intake, high calorie diet, and fluid management. Okay, let's go on another topic, that is glomerulonephritis. It is an inflammation of the glomeruli in the kidneys. This can be acute or chronic. Acute often follows an infection, and chronic can develop slowly over time and lead to irreversible kidney damage. And the causative agents are infections like streptococcal, viral infections like hepatitis or HIV, endocarditis, autoimmune diseases, SLE, Goodpasser syndrome, vascular disease, hypertension, diabetes. And the clinical manifestations are like hematuria, proteinuria, edema, hypertension, ozotemia, oliguria, fatigue, flank pain. Okay, let's go on medical management. As we already studied that it can be caused by some autoimmune conditions or infections. For that, we use corticosteroids, antibiotic and immunosuppressant. For edema, we use diuretics. For hypertension, we use antihypertensives. And in case it is not managed on time, in severe cases, we might go for dialysis. And the nursing managements are monitoring vital signs, blood pressure, temperature, monitor for edema, monitor urine output like there is oliguria, hematuria or other conditions, symptoms as well. Monitor lab values, regular checkup, blood urea, nitrogen, creatinine, electrolytes. Educate patient regarding dietary modifications, medication and sign of complications. Let's go on another topic, that is UTI, which seems very simple but it is also the most important topic. It is infection in any part of urinary system including kidneys, ureter, bladder and urethra. It is most commonly caused by E. coli. Most know the causative agent of UTI. And whereas cystitis is infection of bladder, lower urinary tract, and pyelonephritis is an infection of the kidneys. And the other risk factors for UTI are female gender, sexual activity, catheterization, urinary retention, poor hygiene practice, weakened immune system, older age, and pregnancy. In case of cystitis, there will be dysuria, frequent urination, urgency, hematuria, suprapubic pain, foul smelling urine. And in case of pyelonephritis, there will be fever, flank pain, chills, nausea, vomiting, monoids. If patient is complaining flank back pain, must remember the condition, that is pyelonephritis. As it is infection, antibiotics are used. Antibiotics are typically prescribed for 3 to 7 days for uncomplicated UTI and up to 14 days for complicated and recurrent UTI. And for pain relief, phenazopyridine are used. For this medication like phenazopyridine, must remember that it causes red-orange urine. So educate patient regarding the color of urine. Here we go for nursing consideration. For patient with UTI, adequate hydration is needed. Monitor for complications like sepsis, kidney damage. Provide adequate pain management. Educate on medication administration. To confirm the eradication of infection or in case of recurrent UTI, urine culture is needed. And the last one is patient teaching regarding how to prevent recurrence of UTI. And here are some NCLEX priority actions for not only UTI, for all the infections. We need to provide adequate encouragement regarding fluid intake, administering prescribed antibiotic on time, providing adequate pain relief, monitoring for the complications, and patient teaching regarding the prevention of infection. In case patient is complaining severe flank back pain, fever, chills, this indicates pyelonephritis. So this condition should be reported to the doctor. Polycystic kidney disease. It is genetic disorder characterized by formation of fluid-filled cysts in kidneys. Knowing the definition of this condition is important for the NCLEX. It is asymptomatic in early stage but with disease progress. Hypertension, flank pain, hematuria, proteinuria, polyuria, nocturia, renal calculi, enlarged kidneys, nausea, vomiting, fatigue, respiratory issue might occur. There is no cure for the polycystic kidney disease, but the goal of treatment is to manage symptoms, prevent complications, and slow the progression of kidney failure. Antihypertensives are used to manage hypertension. Pain management is also needed. Diuretics may be prescribed to manage fluid retention. Erythropoiesis stimulating agents for anemia caused by kidney failure, antibiotics if there is UTI or kidney infections, dialysis if polycystic kidney disease progress to end-stage renal disease, kidney transplant for final stage or last stage. And the nursing management of PKDR, monitoring vital sign, fluid balance, monitoring fluid intake and output. If kidney are impaired, fluid restriction might be needed. Daily weight monitoring, pain management, patient education regarding importance of blood pressure control, adherence to medication and dietary modification, assess for complications, psychosocial support. And another topic to know is renal calculi. Renal calculi also known as kidney stones or nephrolithiasis. And stone formation in the kidney can be caused by dehydration, diets like high calcium, high oxalate, high sodium, high animal protein, low potassium, and the medical conditions like hypercalciuria, gout, hyperparathyroidism, obesity, IBD, UTI, and genetic factors like family history, inherited conditions, medications like diuretics, calcium-based antacids, certain antibiotics, like recurrent using of those antibiotics, immobility, chronic medical conditions like diabetes, hypertension, low urine volume. And the clinical manifestations are like severe flank pain, hematuria, dysuria, nausea, vomiting, urinary retention or decreased urine output, fever and chills. If someone is experiencing such symptoms, you can guess this condition in case study type questions in NCLEX. And here we go for the treatment of renal calculi. For the conservative management, we use hydration, pain managements, alpha blockers, and for medical procedures, we go for lithotripsy, ureteroscopy, percutaneous nephrolithotomy. And for surgery, open surgery might be performed, and we do diet modifications for calcium stone and for uric stones. And being a nurse, we need to provide adequate pain management, encourage hydration, monitor for complications, and patient education regarding dietary modification, fluid intake, and signs of complications. We are at the end of renal system now, but there are still some topic to left to know for the NCLEX. So I am just going to explain you the definition. Knowing whole disease process is not important. So now let's go first from the uremic syndrome. Uremic syndrome refers to a group of symptoms and complications that occur when there is a severe buildup of waste product. And the next topic is Wilms tumor. This is also known as nephroblastoma. It's a rare pediatric kidney cancer that typically occurs in children aged 3 to 4 years. And the next one is lupus nephritis, which is inflammation caused by systemic lupus erythematosus or SLE, an autoimmune disease. In this condition, the body's immune system attacks kidneys, leading to inflammation, damage, and scarring. Acute tubular necrosis (ATN). Acute tubular necrosis is a kidney disorder characterized by damage to the tubular cells of the renal tubes in the kidneys. This damage leads to impaired kidney function as is one of the most common cause of AKI. Rhabdomyolysis is a serious condition that occurs when skeletal muscle tissue is damaged and breaks down, releasing myoglobin and other intracellular contents into the bloodstream. This can lead to kidney damage or AKI as a myoglobin is a toxin to the kidneys. So knowing these terms are important in renal system for the NCLEX. You might get such topics somewhere in the case study type or other type questions. So must know these conditions and do let me know if I have left any topic. Thank you for watching and do subscribe.